Hello everyone, my name is Michael Phillip, a physical therapist, and today's video is going to focus on above-knee prosthetics for amputees. Above-knee amputations, more accurately called transfemoral amputations, is a more complex and challenging disability on those than lower on the leg, primarily because the amputee no longer has the knee joint. During this type of amputation, the surgeon will try to save as much as the leg as possible because the longer stump provides better control over the prosthesis. However, without a knee joint, it does make stability and control a little bit more difficult for the patient during that rehabilitation process. Not having a knee joint also requires a more sophisticated prosthesis. Fitting and alignments are difficult procedures that require a great deal of skill on the part of the prosthetist and a great deal of cooperation on the part of the patient. During fitting and alignment of the first prosthesis, it is necessary for the prosthetist to train the amputee in the basic principles of walking. Fitting affects alignment, alignment affects fitting, and both affect comfort and function. Extensive training is then carried out later by the physical therapist. The above-knee prosthesis has four major parts: the socket, knee system, the shank, and the foot-ankle system. The socket is one of the more important parts, and it is critical to comfort and function. For most patients, the socket can be held in place by a suction or vacuum tight that is provided by a close fit between the stump and the socket. The knee system also is a critical part as it needs to function correctly to give support and allow for a normal gait pattern. It cannot buckle when weight bearing through the prosthetic when the knee bends as you walk. Then, just below the knee, you have the shank that transmits weight and forces from the knee system to the foot ankle system. There are two types of shanks: exoskeletal, in which forces are transmitted through a shell that can look similar to a leg and its hollow inside, or endoskeletal shank, where forces go through a central metal tube that may or may not have a shell around it to appear similar to a leg. An advantage of some of the endoskeletal systems is that the knee units of greater complexity can be introduced as the amputee becomes more proficient or his or her functional needs change. Then you have the foot and ankle system. A variety of artificial foot designs is available, each having advantages and disadvantages, but they are classified into two main categories: articulated and non-articulated. Those that are articulated have moving joints to enable the foot to move more like a real foot would during your gait cycle, but they are typically heavier and require more maintenance than non-articulated joints. The non-articulated joints are more rigid but do have some rubber or other flexible materials that can provide some stability and motion similar to that of a real ankle and foot. So that is the basics of your transtibial prosthesis. Make sure to check out our other videos on exercise for amputees or gait training with a prosthesis. Till next time.